So, how are you doing, guys? With you, Dr. Muhammad Hamid, an ECFMG certified physician. I'm going to talk with you today about the cardiovascular system for the USMLE Step 1 exam. So we will start talking about some sign called the Kawasmal sign. So, you know, there is when you take a deep inspiration, the blood is sucked up into your right ventricle, and so consequently is like the jugular venous pressure is decreased. Which means the pressure of your internal jugular vein and your vena cava. So when you have like paradoxical increase in the jugular venous pressure on inspiration, this is Kawasmal sign. So normally, as you inspirate, there is negative intrathoracic pressure, and the venous return is increased, and so consequently, the jugular venous pressure is decreased. But there are some kind of conditions that cause like impaired right ventricular filling, and consequently, the right ventricle cannot accommodate the increased venous return, and instead of the decrease of the jugular venous pressure, which is supposed to occur with inspiration, the opposite occurs. There is like increase in the venous return during inspiration, as I have just said, but the blood backs up and goes into the inferior vena cava, and consequently causes sign. And when we go through the causes of this condition, you will see that there are different kind of causes that will not make the right ventricle accommodate blood. So, at the level of the pericardium, there is inflammation of the pericardium and the constrictive pericarditis. So, the pericarditis that like constrict the heart and not make it able to accommodate the increase in the venous return and to the right ventricle. Also, at the level of the myocardium, there is cardiomyopathy, and the kind of cardiomyopathy that causes Kawasmal sign is the restrictive cardiomyopathy. You know, I have three different types of cardiomyopathy, like hypertrophic cardiomyopathy and dilated cardiomyopathy and restrictive cardiomyopathy. So the restrictive, logically, the restrictive cardiomyopathy is the one who will cause the Kawasmal sign. Also, heart failure, of course, is the right side of the heart has some defect, so the right heart failure causes Kawasmal sign, and the massive pulmonary embolism, there is like obstruction with an embolus to the blood flow through the pulmonary artery, and so it will back up and cause like increased jugular venous pressure with inspiration, which is Kawasmal sign. And some rare causes like right atrial or ventricular tumors, of course, will cause that. We are talking about any cause that will cause like obstruction of the flow. So this is for Kawasmal sign. Our second topic today is like myocarditis. Myocarditis literally means like inflammation of the myocardium. You have the epicardium, pericardium, myocardium, and endocardium. So in myocarditis is inflammation of the myocardium, and it is like a major cause of sudden cardiac death in the young adults less than 40 years of age. For the older adults, essentially the most common cause is like MI due to atherosclerosis that is related to the aging process. But for the younger adults, major cause of sudden cardiac death is like myocarditis. So the presentation will be highly variable, and you don't need to know any stuff for specific stuff, but you have to watch out dyspnea, chest pain, and you have to watch out for the fever. You know, it is myocarditis, so it is an inflammation, and with inflammation, so you may have a fever. So, or you will have a fever, and you may get arrhythmia, and so essentially with fever you will have like a tachycardia, which is proportional to that fever. So, but here in myocarditis, you may get a different kind of arrhythmias, which is a tachycardia out of proportion for this fever. So, different kind of causes for myocarditis. The first three are the infective causes, maybe viral, maybe parasitic, or maybe bacterial causes for infective endocarditis. So, and not only infective causes that are gonna cause myocarditis, but also the toxins and the rheumatic fever and the drugs and some kind of autoimmune diseases. So first is a viral causes of myocarditis. There are like more common viruses like adenovirus and Coxsackie virus, and also parvovirus B19 can cause myocarditis, and the HIV, which is affects multi-systems of your body, but myocardium is some part of your body that can be affected with HIV. You have to know that. And the human herpes virus 6. And recently, COVID-19, some of cases that got like COVID-19 also had like myocarditis as a part of COVID-19 infection. And at the level of the histology, like the viral infections, the cells that is gonna go after the viral infection is the lymphocyte. So logically, you're gonna see like lymphocytic infiltration and some kind of focal necrosis, and which is highly indicative of viral myocarditis. But normally we don't do like biopsy, but this is like hypothetically, if you do a biopsy, you will find like lymphocytic infiltration and focal necrosis. So also the parasites like Trypanosoma cruzi, which is causing Chagas disease, like big problems like dilated cardiomyopathy, and will cause megacolon and megaesophagus. So this is the trypanosoma cruzi and the toxoplasma gonidii. So also will cause myocarditis in like immunocompromised patients, and but it's mostly asymptomatic in like immunocompetent patient, but may cause myocarditis in immunocompromised patient. For the bacteria, just know the names like Borrelia, Mycoplasma, and Crinibacterium diphtheria. Crinibacterium diphtheria myocarditis is like mentioned in the microbiology chapter. We will go and explain that in the microbiology chapter. So, but you have to know that Crinibacterium diphtheria causes myocarditis, and the Mycoplasma pneumonia, which causes atypical pneumonia, not only causes like atypical pneumonia, but also causes myocarditis. And toxins, carbon monoxide, and black widow venoms, like a kind of spider bite, can cause myocarditis. You have to know that. But also you have to know like carbon monoxide can also cause myocarditis. Rheumatic fever, of course, like myocarditis, and like arthritis, subcutaneous nodules, the Jones criteria and stuff. It includes myocarditis, of course. So rheumatic fever also causes myocarditis. For the drugs, you have to know that doxorubicin is like a chemotherapeutic agent, and the cocaine are implicated in the myocarditis. They may cause myocarditis. And autoimmune diseases that can cause myocarditis. Just know the names here, and we will go in for them in details in the immunology chapter. So Kawasaki disease, like sarcoidosis, systemic lupus erythematosus, polymyositis/dermatomyositis. These are different kind of autoimmune diseases that can also affect the heart. So the complications, nothing specific, sudden death, of course, arrhythmias, heart block, dilated cardiomyopathy, heart failure, and mural thrombi, and systemic embolism. So there is next topic is hereditary hemorrhagic telangiectasia. So the name tells the disease tells a lot about the disease. So hereditary hemorrhagic telangiectasia. First, hereditary. So it is autosomal dominant disorder. First, from the name hereditary, it is autosomal dominant disorder of blood vessel, of course, hemorrhagic. So the other name for hereditary hemorrhagic telangiectasia is Osler-Weber-Rendio syndrome. Osler-Weber-Rendio syndrome, aka hereditary hemorrhagic telangiectasia. And from the hereditary, we have said that it is autosomal dominant disorder of blood vessels. And also from the name tells us that it has telangiectasia, which is blanching lesions, like blanching lesions when you press your with your hands on them. So telangiectasia, autosomal dominant disease, Osler-Weber-Rendio syndrome, and also it affects like the skin and the mucous membranes. You have to know that it not only affects skin but also affects like the mucous membranes, and it causes like recurrent epistaxis and arteriovenous malformation. So the arteriovenous malformation in the hereditary hemorrhagic telangiectasia may be in the brain, maybe in the lung, maybe in the liver, and so also there is like GI bleeding or hematuria, different kind of mucous membranes. The mucous membrane is the nose, like recurrent epistaxis, the mucous membranes is the GI tract, GI bleeding, and the hematuria, different kind of mucous membranes affections causing like bleeding, and the arteriovenous malformation, which are like abnormal high flow connection between the artery of the veins, like instead of like the arteries going like into arterioles, and so and like going smaller until they make a connection with the veins. There may be like a high flow direct connection between the arteries and the veins. So this is in essence is like arteriovenous malformation, which may be found in hereditary hemorrhagic telangiectasia. So next topic, not very high yield, is like cardiac tumors. There are myxomas and there are rhabdomyomas. So the difference between them, myxomas like most common, and the rhabdomyomas also are most common, but the most common in adults are the myxomas. The myxomas are the most common primary cardiac tumors in adults versus the rhabdomyomas, which are most frequent primary cardiac tumors on the children. And you have to know like that the myxomas occur 90% in the atria. So like the left atrial myxoma, you know that the left atrial myxoma very famous to be occurring in the atrium, versus the rhabdomyomas, which at the opposite are more common on the ventricle. So you have to know that myxomas in adults, rhabdomyomas in the children. Myxomas occur in the atrium, rhabdomyomas occur in the ventricle. And the last piece of information for rhabdomyoma is like a part of the tuberous sclerosis complex. So it's just like tuberous sclerosis have like hamartomatous growth. So it is rhabdomyoma is a hamartomatous growth through the brain and different kind of organs. So it is very characteristic to have like seizures as for the tuberous sclerosis and the skin infection, angiofibromas. So different kind of affection is the skin and the brain and the heart. So this is like tuberous sclerosis complex due to mutation in the TSC1 or and 2. So this is for the tuberous sclerosis. We will explain it further. So for the myxoma, as again, this is the most common primary tumor in the adults, and 90% occurs in the atrium, most commonly in the left atrium. And this may cause like a ball valve obstruction in the left atrium associated like multiple syncopal episodes. Like it's gonna make like obstruct the left atrium. And there is a characteristic thing in myxoma, which is IL-6 production. So the IL-6 is like a mediator of inflammation, and of course it's gonna cause like constitutional symptoms like fever and weight loss. So you will have like typical patient who has like ball valve obstruction, may come with multiple syncopal episodes. You are not going to know which what is the cause for these episodes, and along with that he may complain with fever and weight loss due to the IL-6, which is produced by the tumor. So you have to put the puzzles together and suspect that he may have just atrial myxoma. He's gonna be an adult, and by auscultation you will have like early diastolic tumor bulbs, like it's the same of auscultation for mitral stenosis. So the mitral stenosis will have also early diastolic sound, so that the tumor blob sound, and there's the gelatinous material and the myxoma cells immersed in glycosaminoglycans versus the hamartomatous growth for rhabdomyomas. So